Okay, it is time to go to CVCA for Beau's annual heart testing. That is an echocardiogram and a 24-hour Holter monitor. These are things that you absolutely need to do every year if you have a Doberman. You ready? Okay. Let's get in the car. Okay, up. Okay, we're here, and you're wearing your bow tie for the special occasion. Yeah. We're gonna go behind that door, and then you're gonna get your sensors put on and your little armpits shaved. Good boy. Hanging out, being calm, waiting for our turn. I'd like to point out that there is a nice dog right over there, and another one behind us. And he is completely unbothered.
Good boy. Getting blood pressure done. He's like, thank you. Good boy, Beau. Can I see your paw? Good boy. Good boy, Beau. Good boy.
Okay, so while Beau is getting his little armpits shaved, let's come look at this chart on the wall that talks about the two most common causes of heart failure in dogs. We have atrioventricular valvular insufficiency, which is a degenerative disease of the heart valves. And the one that I'm most concerned with because of the Doberman scourge is dilated cardiomyopathy, or DCM, which is a disease of the heart muscle in which the muscular walls of the heart become weakened, decreasing the ability to contract and pump blood effectively. It states as the disease progresses, the heart continues to stretch and enlarge, and it's more common in medium to large sized dogs. And I've actually heard a statistic that it affects 60% or more of Dobermans. Here's a close-up of the heart with the anatomy. And then for those interested in AVVI, please don't make me say that long name again. Here's a close-up of that. And the key, we have our atriums, our ventricles, our vena cava, our arteries, our veins, valves, and the aorta. So there you go. What you should know about congestive heart failure in dogs.
Hi, handsome. Hi. You look so silly.
Previously about 31 millimeters.
Okay.
I was getting that at 34 to 35 millimeters today, so we're not contracting down as far.
Okay.
The chambers were the same size and still normal, so I'm not seeing any dilation of the heart at this point. Measuring the heart function the other way, when we look at the heart where you can see kind of the bullet shape and it's squeezing and measuring, tracing out and measuring the shells there, I'm getting the same number there. So I'm getting an ejection fraction of about 55% there, which is normal for a Doberman.
Okay.
In terms of what we do at this point, let's see what the Holter monitor looks like and what we're doing throughout the day. What I suspect is based on the number of single premature beats we were having here, if you look at the criteria for do you have dilated cardiomyopathy or not, for a highly predisposed breed like a Doberman, the number's like 50. If you have 50 in a day, that's consistent with you probably have what they would call occult or preclinical dilated cardiomyopathy.
Okay.
Without heart chamber enlargement, the study's looking at starting treatment. I don't know that I would start anything at this point, just because there's no data to say that from this early stage you do better if you go on vetmedin or an ACE inhibitor or anything like that. If we are finding that we're having a significant number of premature beats, but just singles, we wouldn't treat those at this point, but he'd be a dog that I'd probably go to watching, say, every 6 months, at least for this first go around to see, are these little changes we're seeing today more significant changes when we're in.
So is this something that, given the breed,
yeah,
does this jive for you for 3.5 years?
3.5 years. I mean, I think he's being more proactively screened than most Dobermans his age.
Yeah.
I will say the dogs that we meet in heart failure, generally are somewhere between, say, like 5 and 8 years of age, generally.
Right.
To think that they might have their earliest changes when they're 3, I think it's certainly possible.
Okay.
Like I was mentioning, where his physical exam, he doesn't have a heart murmur, so if you were to listen to him and not hear his premature beats, he sounds like a normal dog. The vast majority of Dobermans, though, if they don't have a heart murmur, if someone doesn't perceive an arrhythmia on them, probably aren't seeing a cardiologist.
Right, and I'm following the breeder recommendation and my mentor recommendation of getting screened every year when he hits 2.
Sure.
So is he healthy?
At this point, so right now my suspicion is he feels absolutely fine. That, this doesn't make him feel poorly. By the book, again, if we have above that threshold number of premature beats, technically for the breed, he has dilated cardiomyopathy.
And we wouldn't start treatment.
So yeah, at
the occult stage.
At the occult stage, if the arrhythmia is just single premature beats, and if they're not very, very frequent, if they're not say like
50 or under.
Yeah, if they're not like 50 or under is just a threshold to say positive or negative for DCM.
All right.
Treating, if you're only having singles, if they're under, usually how I treat it, because chasing down single premature beats and trying to make them go down with medication.
Yeah.
My experience is usually it's frustrating.
It feels like whack-a-mole.
It absolutely is. Seldom do I feel like we make them go away, and oftentimes it feels like we're not doing anything.
Okay.
If it's under 10% of the number of total heartbeats, which, knock on wood, based on what he was showing here, it probably certainly is. Generally we don't treat those, we monitor those if they're singles. If they're runs of rapid heart rate, that's what's dangerous. That's what's the risk for sudden death. That's something that we would start medication for.
Okay, so right now, we're going to look at the Holter.
Right.
And then determine, are we doing this again in 6 months? Are we doing this again in a year?
Yeah, I would say with the fact that the strength of his contraction, at least by one measure, was coming down a bit, I'm going to want to see him in 6 months to see is that progressing or not.
Okay. Is there anything physical I can do? Any supplements, vitamin E?
Yeah.
Restrict activity? What would you do?
At this point, normal activity should be fine for him. At this point, in humans with this disease, it's endurance activity. So we're talking distance runners, stuff like that, where potentially that type of activity can be a problem and progress the disease faster.
Okay. Should he lose weight?
No, he's perfect where he is.
What I thought.
Yeah, I wouldn't have him lose
he was
weight
looking
where he is.
skeletal at 82.
He looks great at this weight.
Okay. If he was your dog,
would
you be saying your goodbyes?
No.
Okay.
No, not at this point. It is a disease where sudden death's a possibility with this disease. By its nature, it happens suddenly.
Yep.
Typically, it's in dogs who have more advanced overt heart disease where we see that.
Yeah.
I'm not going to say it's impossible for a dog who's in the
Right.
occult stage.
Right.
In terms of a guy who's staring down heart failure or something like that, no, absolutely not at this point. Again, we've got one, granted, important measurement, but one measurement that took a jump from last time around. You know, otherwise we got a heart that's still, even though the contraction, I'm going to describe it as being mildly decreased by that measure.
Right.
He still has a heart that's not dilated though.
Okay.
So he's got sort of, you know, equivocal to mild systolic dysfunction, but otherwise normal heart size.
Okay.
You know, he doesn't have the dilated part with dilated cardiomyopathy at
And
this point.
for the contraction that didn't quite get as small as you wanted,
Yeah.
dumb that down for me. That means
Yeah.
the blood's not moving out of the heart.
That means that, so yeah, again, and this is where it gets a little confusing because we measure it multiple ways.
Right.
Some of those numbers were coming up the same, sort of like low normal, but still normal. That was the one that each time I measured it, I kept getting 34, 35 instead
So that
of
was the
31.
consistent.
So that was pretty consistent.
And that's when the heart's
And so
contracting.
so that's when the heart's contracting. So what that reflects is if you're not contracting down to the same minimum, it's a sign of a weaker heart contraction than where we were.
To get blood into the heart or out of the
Out
heart?
of the heart.
Out
So
of the heart.
squeezing's
That's what
to
it
get
makes
out.
sense.
Yeah,
That's what
yeah,
it makes
relaxing brings the blood
Brings it-
in,
yep.
squeezing pushes the blood
That's
out.
what I was trying to
Gotcha.
get
Okay.
to. Gotcha. Okay,
Sure.
that makes sense. All right, so right now,
Yep.
keep on keeping on until you
Keep-
tell us otherwise.
Keep on keeping on. Let's see what the Holter looks like. Yeah, and we'll go from there.
Okay, we are back and it is the second day with Beau wearing his Holter heart monitor vest. We'll head back up there in about 2 hours to have them remove it and they'll grab all the readings and then we'll have the final report for this year. The final results of the echocardiogram and the 24-hour Holter are in, and the diagnosis is suspected occult dilated cardiomyopathy, which essentially means that Beau is in the preclinical stages of DCM. If there is good news, it's that the Holter shows that the ventricular premature beats are occurring one at a time, and there were no signs of ventricular tachycardia. Right now, the cardiologist recommends that we can continue with Beau's current level of activity and no treatment is indicated. Given the readings, he does want to see us in 6 months rather than 12. I can't say I'm really excited about the results. I was hoping for a perfectly clean bill of health, but none of this is surprising given how prevalent DCM is in the breed. So for me, I'm just going to enjoy all the time I have with this little weirdo and cherish every day. Thanks for watching. See you next time.